When Aunt Miriam falls down and breaks her hip in immediately 30 seconds, she has a 30% chance of dying in the first year. If she recovers 50% of the time, she will not return to the home that she lived in before because she can't take care of herself. So that is why it's so important to talk about our bones in a way that maybe you've never heard it before. Hi, I'm Dr. Vonda Wright, and this is Hot for Your Health. Join us for conversations on the bleeding edge of science, health, and culture as we bring you tech innovators, thought leaders, and the movers and shakers who are transforming science fiction into your new health reality. Hi, everybody. I'm Dr. Wright, and welcome to another episode of Hot for Your Health, where you know I bring you change makers, amazing innovators, and just plain interesting science and people. Today, I'm going to do one of my rare solo casts. You know, I love talking to you, but I don't often get her alone because there's so many interesting people to talk to. But I have to talk to you about something that I've been talking about all over the world. And I want to make sure to get it in our books too. And that is bone health. It wouldn't surprise you for me to talk about bone health. And yet I don't think we've ever done it before. So I came today straight from the operating room where, as you know, I'm an orthopedic sports surgeon. And not only do I do that, but I take care of people who have fallen down with fractures. And so as I talk about bone health, I want to start out by startling you a little bit. You know, most of us don't even think about our bones, unless maybe we're standing in the mirror and we're saying, oh, what gorgeous cheekbones we have, or maybe we fell off the curb when we were walking our dog and we broke our wrist. We think about our bones then. But the fact of the matter is, we think our bones are silent, that they're not doing much except holding us up in human form, maybe providing the scaffolding for our muscles. But the reality is, bone is not only your scaffolding. It's actually not the strong, silent type, just standing around, waiting to be supportive of muscle, which is otherwise without bone, just a heaping pile of metabolic tissue. Bone is actually the storehouse of all the minerals that your body needs for every chemical reaction that keeps you alive. Bone is actually the place where you make your blood cells in the pelvis and the long bones. Bone is actually a master communicator. It's an endocrine organ, secreting hormones that do a variety of amazing things that we're going to talk about today. This episode of Hot for Your Health is brought to you by Alloy Health. At Alloy Health, they're on a mission to make evidence-based menopause care accessible, starting with real doctors who specialize in perimenopause and menopause. And here's how it works. You go to myalloy.com, complete a short questionnaire, and get connected to a board-certified menopause-trained physician within hours. They will create a personalized treatment plan just for you. Hormone therapy, yes, but also support for your mood, sleep, sex life, weight, hair, and skin. And listen, speaking of skin, Alloy doesn't treat it like an afterthought. Hormones influence collagen, hydration, elasticity, everything. That's why Alloy created M4, a prescription skincare line made with estriol, a low-dose estrogen that has a big impact on improving skin health, quality, and resilience. It started with the M4 face cream, and now Alloy's added 2 game-changing new products, the M4 eye cream, the M4 serum. These aren't over-the-counter beauty products. They're prescription strength formulas backed by clinical trials with results like smoother skin, improved firmness, and brighter, even better tone. This is all because your skin's changing and your routine should too. Now listen, I'm just not telling you to do this because I like Alloy. I'm telling you to do this because I use M4 and M4 eye serum, and it has made a huge difference for me. So I'm bringing you what I use. I'm bringing you estradiol in patches and estriol in face cream. because they've changed my life. So we're thankful today for my alloy for supporting Hot for Your Health. Maybe the first time you noticed your bones was when someone like your Aunt Miriam fell down and broke her hip. You know, about a month ago, I was invited to speak with a group of other experts at the FDA, where we were talking about the role of estrogen in a variety of women's health subjects. And of course, as the bone doctor, I came armed with all kinds of data, because bones are not silent and they're not unimportant. When your Grandma Miriam or your Aunt Miriam falls down and breaks her hip, the minute, just like the snap of a fingers, the minute that she breaks that bone, she has a 30% chance of dying in the first year because of the stress, the complications, the things that happen from laying in bed all that time. And when she breaks her hip and has a 30% chance of dying, if she recovers 50% of the time, she will not return to the home that she lived in before because she can't take care of herself. And so that forces her family, such as you and me, to make really hard decisions. Do we hire someone to take care of her full time? Does she move in with you? Does she go into an assisted living where it costs between $7,000 and $15,000 a month to pay for that until she uses all of her life savings and goes on Medicaid to pay for that? Those are 4 really hard choices that come from something that we could have prevented. Osteoporosis, or holy bone, if you translate from the original language, is a disease that can be prevented. And so when Aunt Miriam falls down and breaks her hip and immediately, 30 seconds, has a 30% chance of dying, when I meet her in the hospital or the emergency room, she's usually crumpled up at the bottom of the bed because it hurts so much to move when you have a big fracture, such as a femur fracture. And to take her to the operating room, I have to get clearance from the medical doctors for her heart to withstand the surgery. And that is often delayed because women through midlife can have a lot of heart disease, and we're going to talk about that. But not only do those things going on, often she has a urinary tract infection because she's never been offered vaginal estrogen for the genitourinary syndrome of menopause. And finally, due to the stress of the fracture, or maybe because she's developing Alzheimer's, she is not herself. That is the picture of women that I see in the hospital when they break their femur. So that is why it's so important to talk about our bones in a way that maybe you've never heard it before. So not only our bones are structural, and maybe you never think about them until your grandmother or your aunt or your own mother ends up in the hospital with a big fracture. But the fact of the matter is, bones are structural, they're supportive, they are the storehouses for the minerals that our body needs, they are incubators for all your blood cells, and they are master communicators. So I thought you, of all people who listen to a variety of experts come on this podcast, should know how to take care of your bone health across your lifespan. So in the next 30 minutes or so, I'm going to talk to you more about all the amazing things bones do so that you have a better appreciation. We're going to talk about how we should be concerned about bone, not only when Aunt Miriam or Grandma Miriam breaks her bone when she's in her 70s, 80s, and 90s, but across our health span. But we're also going to talk about how to build better bone. So buckle up. We're going to talk about this amazing subject. And as we're doing it, just pay attention to your bones. Feel this bone right here. This is your ulna. This is the other side of the ulna. Here's your temporal arches. These are bones. Feel the side of your hips. Those of your femurs. Let's start paying attention to these miraculous structures. So when I talk about bones being endocrine organs, what does that even mean? Well, an endocrine organ, like muscle, like your adrenal glands, like your thyroid, are organs in your body that can secrete hormones that then not only talk to themselves in an autocrine, meaning talking to ourselves manner, but also talk to other parts of your body. The hormones go off into the bloodstream and talk to other parts of the body. So what are bones talking about? I think you're going to be amazed. One of the hormones that bones make is called osteocalcin. When we're done today, I want you to be fascinated. Go Google it. Go look it up. Osteocalcin is secreted by bone cells, exit the bone, and it can go to the brain, where it can help your brain make another hormone called brain-derived neurotrophic factor in the nucleus ceruleus part of the brain, and it can help you make new neurons. Oh my God, did I just say that your bones are building better brain? Yes, I did. What else does osteocalcin do? Well, if you're a man, and some of you are men, or some of you love men, it goes to the testicles and it helps the Leydig cells make testosterone. Bones help make testosterone. Yes, they do. But amazingly, bones are critically involved in energy balance in your whole body. And when you think about it, why wouldn't it be, right? Our bones are the storehouses of minerals. So of course it's going to interact with other organs such as your gut. There's actually a bone-gut axis where it talks together all the time. But osteocalcin also goes to the pancreas and is critically involved in insulin secretion. And remember, insulin is the critical protein necessary to help absorb glucose out of the blood. So osteocalcin also goes to the muscle to help the muscle with glucose metabolism. There's another hormone that the bones secrete called LCN2, which does a variety of functions in the body. But do you know that it goes to the brain and helps with satiety? In other words, it helps you decide that you're full and you've had enough to eat. So just when you think that your bones are only about holding up your muscle and having the posture of a human being, I'm telling you that they are an endocrine organ and critically involved with a variety of communication. And let's think about it. Why wouldn't your bones be involved in something like that? Because if I were designing a system that had to communicate it in a very complex way, I would want a pathway of communication from the very top of the organism to the very bottom of the organism. Think about it. Bones are everywhere from the top of your head to the bottom of your pinky toe. So of course, it's a communication highway. It's structural. It is an incubator, and it is a storehouse, and it's worth taking care of. But so many times when I meet Grandma Miriam in the emergency room because she's broken this hip, it's the first time that she's ever thought about her bones, and she's not alone. The reality is bone health starts when we're teenagers. Essentially, we're born with our bones in a very soft cartilage state, right? We're always told to be very careful with babies because their bones are so soft. Well, they are. But those bones gradually mineralize and get hard. And that happens after puberty in our teen years, such that we reach peak bone density between about 25 and 30. So what does that mean? We're going to have the most bone we're ever going to have at that time. So what do we need to do when we're young to build better bone? Well, the sad truth is I find by doing DEXA scans on everybody that I have 20-year-olds and 24-year-olds and even 30-year-olds with very poor bone health. And so it got me thinking, what is going on that these very young people are not laying down enough bone? And I came up with several answers. Number one, maybe the young people I'm seeing are still buying into the myth that they have to be teeny tiny and skinny. and therefore they're not eating enough food to regulate their hormones to build better bones. Maybe because we're in our 54th year of Title IX, which equalized men and women's sports, maybe, like some of the athletes I've taken care of, you're working out so much, 5,000, 6,000, 7,000 calories a day, and it's just hard to keep up so that you're not in relative energy deficiency and subjecting yourself to stress fractures because your bones can't withstand the stress and strain of that activity. Or maybe there's a third option. Maybe you're eating enough. Maybe you're not an athlete. Maybe you're a digital native who is student sedentary. And if we sit and are sedentary most of our lives, we're not building bone, because bone must be impacted, and I'm going to teach you how to grow. And bone needs the strength of muscle pulling on it to be optimally built. So those are the reasons that sometimes even young people do not reach a peak bone mass that sets them up for the rest of their lives. And then there's another time in our lives when we have to be concerned about our bone health, and that is when we're having children. So if you decide to have children, it takes about 500 milligrams of calcium and other minerals a day to build a baby. Now, our bodies are designed to replace that bone, but you can lose, depending on who you read, anywhere between 6 and 15% of your bone density while you're pregnant, and it's called the osteoporosis of pregnancy, and it's a real entity. The good news is that your body is designed to rebuild that bone. The problem is if we don't, or if we start out with very low bone density, or we have hyperemesis of pregnancy and we're just nauseated all the time, or maybe we're just too busy and we're not eating enough, and we don't replace that calcium and minerals as we're building a baby. It's something to be aware of. There's another drain on your bones after you deliver the baby if you are breastfeeding. Now, hear me. I am pro breastfeeding for women who decide to do it. But what you must be aware of is that to produce milk, it takes calcium, right? In fact, in nature, lots of minerals and calcium and protein comes in mother's milk. So if you decide to do that, don't forget that every time your baby latches on, to eat some whole food, including calcium-rich foods, to replace what you're taking from your bones so that you rebuild from your pregnancy and you rebuild from your breastfeeding. Your body is designed to do it, and yet often we do not. So if we're reaching peak bone density at 30 and we're replenishing our bones, if we decide to have children, what happens to them? Well, in both men and women, there's a natural decline in bone density of about 1% a year. It's a normal aging pattern until, for women, a cataclysmic series of events happened such that you lose bone density at twice the rate that you normally would. And what is that cataclysmic phenomenon? It's called perimenopause. When you have used up, in normal ovulation, all of your eggs except for 1 to 3%. And this usually happens in women on average around 45. Around 45, you have so few eggs left that you're not producing enough estrogen. And therefore, you're not going to be building enough bone. Here's how bone works. In a bone, let's say your femur, which is kind of shaped like my forearm, you have a variety of cells. There's an osteocyte, which is a mature cell that lives in little caves in mature bone. And then you've got two other kinds, one called an osteocyte, C-Y-T-E. I'm sorry, an osteoclast, C-L-A-S-T, osteoclast, whose job is to absorb bone. It creates an acidic environment and bone is resorbed. And then you use all the minerals that you release. Balanced with that, when you have enough estrogen, are the osteoblasts with a B, B-L-A-S-T. Their job is to build bone. And when we have enough estrogen prior to perimenopause, bone building and bone breaking down is pretty balanced, actually, because estrogen controls the osteoclast so it doesn't eat or reabsorb too much bone. And we live in this relative balance, and dynamically, this is happening throughout your entire life, such that every 10 years, we completely replace our bones through this remodeling process. But without estrogen, what happens? We become out of balance, and our osteoclasts resorb more bone than our osteoblasts can build, to the tune of losing 15 to 20% of our bone density in our perimenopausal period. So if we're already starting with low peak bone density, we arrive in perimenopause from a low starting point, and it is not uncommon for me to discover women in perimenopause in their 40s with low bone density, which sets you up for the next 20, 30 years if you choose not to replace your hormones to develop worse and worse osteoporosis and potentially break your hip. 40% or more, sometimes 50% of women will have osteoporosis, and 1 in 2 of them will have a fracture. 1 in 2, so it's either going to be me or it's going to be you. And when I say it like that, it really brings it home. This is nothing to ignore. Bone health is a lifespan phenomenon. So, how do we prevent fracture? How do we keep our bones as healthy as possible? Well, there are a few ways. There are 2 in particular that are critical, 3 important. Number 1 way to build better bone is to make your hormone replacement decision. Estrogen, progesterone, and testosterone are critical for bone health, with estrogen being one of the primary. When you enter perimenopause and you have less than 1% of your eggs left, and you start feeling all the things that you hear in society, brain fog, night sweats, not yourself, anxiety, rage, total body pain. When you start to feel those things, you don't know it, but your bone balance is off, as we discussed. That is a critical time to make a decision whether or not you're going to replace your hormones. Now, I'm going to say this because we're friends. I believe that every woman is a sentient being and has the agency to get to choose whether you replace your hormones or not. It is not only something to do to get rid of hot flashes, night sweats, and brain fog. No. In fact, in my opinion, that's one of the least reasons to do it. The decision should be made based on science and not fear. But here's what we know. There is no debate that replacing your estrogen can rebuild your bone balance and help prevent fractures. The data is clear. The data are also clear, even from the Women's Health Initiative, that replacing your estrogen can decrease your heart disease by 46%. That is almost 50% decline in heart disease. Heart disease is the #1 killer of women. We believe from the work of Dr. Robbie Brinton and Dr. Lisa Mosconi that estrogen plays a critical role in your structural brain health, but also your mood. And the reason for that is because the brain is covered in estrogen receptors. So there are at least 3 big categorical reasons to make this decision, but it must be based on facts, not hearsay, not fear. As I know that because many women in my office tell me they're fearful of this decision because of what they've heard about the Women's Health Initiative, the study that in 2002 took estrogen away from generations of women because it scared women into believing that estrogen would cause breast cancer. But actually their own data show that there is no increase in breast cancer death, and that estrogen alone in that study did not increase the incidence of breast cancer. And we'll get into that another time. And in fact, on this podcast, if you want to go back and listen to the episode I did with Dr. Corinne Menn, M-E-N-N, she is an expert in this. Go back and listen to this if you want all the data on estrogen and breast cancer risk. So we were talking about bone today. Number one decision, which you're capable of making, is will you replace your estrogen to save your bones? Data shows that in order to have the best effect on preventing the fractures we started out talking about, we need to be on estrogen about 10 years, which means starting in perimenopause or right at menopause, not waiting until we have a fracture to start. Now, you can start it then, but it's better to start long in the past. Okay, so that's number one. Make that decision. Number two, the way bones are stimulated to be remodeled and built, remember the osteoclast and the osteoblast, they are stimulated to build better bone by impact and by stress. So how do we do that to our bones? Two ways. We stress our bones by pulling on them by building muscle. So we can rebuild our bones to the tune of 3 to 7% with hormone replacement. We can rebuild our bones by heavy weightlifting about 8%. That is significant. Those two things alone are critical for your bones, that we make the decision and we learn to lift heavy. You will have seen me all over the internet jumping around, teaching you to do plyo, jumping off an 8-inch step to bash our bones, to impact our bone. It takes us jumping around at about 3 to 4 times body weight, which you can achieve by jumping off an 8-inch step. You don't have to do it like I do it, which is jumping up and down off a 24-inch step. You can do it with 8 inches, but you must jump to cause the biomechanical impulse that will be translated into the biochemical message, we've got to build some better bone, right? What these interventions say to us is that we have amazing control over our bone health, right? We can make a hormone decision. We can choose to learn to lift heavy weights. We can jump up and down. So what are the other things that you hear around? Well, 50% of our bones are protein. To build better bone, you have to eat. My generation, Generation X, was the generation that was taught to believe that you have to be teeny tiny. The reality is that you can't build better bone, you can't build muscle, and you can't be optimally healthy if you're starving. So I recommend to my patients, and you've probably heard me say this, that we eat a high protein diet. Bone is 50% protein. In addition to a high protein diet, we eat an anti-inflammatory diet, meaning we cut out simple sugars. We are not going to poison our bodies by being too sweet on the inside. And that's critical for bone also. I'm often asked what supplements you need. Well, the data on whether or not we should be supplementing minerals for our bones is actually plus minus. But there are lots of reasons that I suggest that people eat their calcium in their food. I prefer that over taking a calcium supplement. So what are high calcium foods? Well, dairy is high calcium. Sardines, if you like that. Salmon with bones, because you can cook salmon and the bones will get very soft. Lots of calcium. Prunes, interestingly, there are lots of high calcium foods because we need about 1,200 to 1,800 milligrams a day. It's not that hard to do if you are conscientious. So high protein, high calcium foods. Yes, we need vitamin D. You should have your vitamin D tested. Vitamin D has a myriad of effects in the body, not just for our bones. And most of us don't get outside long enough to make vitamin D from the sun. So we should supplement with vitamin D, not just for our bones, but for everything. but we must have that level checked because you can overshoot. Magnesium is great for bones. I particularly take 500 milligrams of magnesium at night to help me sleep. And oh yes, it's also one of the minerals in your bones. So it's not a huge stack, but it can be bone supportive. But the best things you can do for your bone is make your hormone replacement decision, jump up and down, lift heavy weights, and pay attention to your bones from your youth. I know it sounds like a lot. It's actually not that hard, but I hope I've made a case for you today about how bones are not just the strong, silent type hanging around, waiting for someone to correct your posture, but bones are the storehouses in your body. They are the incubators of your blood cells. They are the master communicators from the top of your toes, from the top of your head to the bottom of your toes. And oh yes, they do keep you upright and support your muscles so that you look like a human being. And bone health is a lifetime pursuit from our youth all the way to our old age. I hope this has given you a new perspective today. You know, I'm talking about this everywhere right now because I just think it's so important. So if you want to find out more about building better bones, I have two options for you other than listening to this. Number one, my book Unbreakable, which is a nod to bones, but is so much more, is actually out. Every question you've asked me online, I've attempted to answer here. So this is an amazing resource. Also, you may have heard me talk before. I have a 4-week course called Building Better Bones that we will put a link to in the show notes. Because if you're a scholar and you just want to learn more and really get in front of this, this is a great 4-week way to understand what's going on. So thank you once again for joining me for Hot for Your Health. Thank you for letting me do a solo cast to be so passionate about a subject that's critical to me, but it's critical to you, not only because it affects people you love, but because 1 in 2 of us will experience an osteoporotic fracture in our lifetime. And I don't want it to be you. I certainly don't want it to be me. So thanks for joining me. I'll see you next time on Hot for Your Health. Thanks for joining us on Hot for Your Health, where we bring you conversations from the bleeding edge of science, health, and culture. You can find links from today's show and connect with me at drvondawright.com. Don't forget to subscribe and leave a review wherever you listen to podcasts. I'm Dr. Vonda Wright. See you next week.